Well, thanks so much for that kind introduction. And when I was thinking about this presentation, I was reflecting on all the things that went right during this Sloan launch of microbiology of the built environment. And essentially, from start to finish, we've had a taste of not only how science could be done, but how it should be done, and too frequently is not. And it's been amazing to be on this journey with you, and such a great group of scientists full of humility, the lack of academic gamesmanship in general, and we're on this voyage of mutual discovery. And I really just wanted to call out, some of the better actors. All of us really just did a great job, but Jonathan Eisen in particular, I follow his blog, Microbiomania, very, very closely. And I just wish every new area that was being launched that's considered a hot area of science had someone like Jonathan there to sort of manage expectations. And I think all of science would be better if that actually occurred. But all good things come to an end. And we're currently considering our uncertain future, as much as we'd like to stay in this nest. And that got me thinking about where things went wrong for me personally in my career, and so I wanted to give you three different visions of our uncertain future as viewed through actual events and the prism of the Flint drinking water crisis. Now, I'm going to start by taking the positive spin, which is, gee, this could be science as it should be. And we were one of the fortunate ones, Dr. Pruden and I and our team that eventually did help with the relief effort in Flint. And we had some funding to study the relationship between municipal water and building plumbing systems and pathogens. And we treasured every moment of that opportunity. We had a lot of really great discoveries. And one of them that occurred in summer of 2015 was interesting. We were looking at the effects of chlorinated, chloraminated, and water without disinfectants if it went into different pipe materials, including cement or iron or PVC pipes. And then we simulated what would happen to pathogen growth in water heaters of homes. And so this finally came out in Environmental Science and Technology in July 2015. And just to give you the very simplified equation here, we concluded, if there was ever a case where you did not have corrosion control with iron because it would then release nutrients, remove chlorine from the water, you would have everything you needed for a Legionella outbreak. And it was around that time things were going really, really bad in Flint. That's a whole other different story. But when I started preparing a proposal about how we might be able to go into Flint for a National Science Foundation RAPID grant, we looked at the history of this, and we realized that this water switch occurred in a system with unlined iron pipe and no corrosion control. And so the question was would there be a Legionella outbreak? And so this is just 2 weeks after our paper was published. We loaded up my wife's minivan, and we took a sampling team and sampling equipment to the field, not to look for lead, because we were doing that in a different way, but we were looking for Legionella. And after a very intensive few days on the ground, we came back and we had to report on our Flint Water Study webpage that despite our amazing hypothesis and the work we'd done for Sloan, we looked at single-family homes and we could really find no evidence of harmful Legionella in those waters, contrary to our expectations, but all the conditions were there. So it was really something of a mystery. Why weren't we finding Legionella? So we kept working on it. We didn't give up. And we, once again, launched our minivan sampling excursion. And this time, we looked in large buildings. And this is a picture of what is supposedly potable water in McLaren Hospital, and hence I think you understand why people were complaining. And when we came back and we analyzed those samples from hospitals, healthcare facilities, and large buildings, it was a different result entirely. It was very, very shocking. This is some of the data we had where we looked at these small buildings and we had very low levels of Legionella, none of the harmful serogroup 1 type, the ones that most at risk for human infection. But when we went into the large buildings, we found a lot of serogroup 1, in particular of the type that is very virulent. So we got on the phone and we called the county health department and we said we're probably going to be announcing these results in a few days. And they said to us, can you wait because we have an announcement we want to make before you announce. And so we did that. And what we didn't know at that time was that the state and federal agencies involved knew that they were in the midst of one of the most serious Legionella outbreaks in U.S. history and hadn't told anyone. And so this is kind of what we're talking about here. If you look at this timeline, this is the Legionella incidence in Genesee County reported as a function of time. And you see that time period where they switched to the Flint River water without any corrosion control and the massive spikes in reported incidence of Legionnaire's disease. And behind the scenes, you know, folks were talking about this, and you got to realize in their defense, there had never been a study previously linking poor management of a drinking water system to a massive Legionella outbreak. It was generally thought that this was associated with cooling towers. But they did discuss this in 2014, 2015, and they decided not to reveal this to the public because they thought it would inflame the situation in Flint. And so they did announce it before we announced our data, and I think our data was the final thing that pushed them over the edge because we had this information on large buildings, and so it just added another dimension to what has become known in the press as the Flint drinking water crisis. So this is an incredible opportunity. This is not only one, by some measures, one of the largest Legionella outbreaks in U.S. history, but it's also the first that's been tied to a water distribution system, how it's managed. So we're now doing whole genome sequencing of Legionella that has been isolated from Flint, Michigan water during our sampling trips. And we're doing this courtesy of Sloan and the great work of David Coyle and, again, Jonathan Eisen. But the idea here is we got samples from waters of the hospitals, the homes, and also the clinical isolates. And when we do this sequence-based imaging ongoing, so the phylogenetic analysis, this is preliminary, but what you can really see is clustering of the different strains of Legionella isolated from the water of hospitals in purple compared to homes in yellow. There seems to be differences, and there's some similarities between the clinical isolates and the water samples, and of course this will become important as we go ahead. And if we kind of zone in on there, there's 99.6% plus similarities. So this is going to be a big interest not only in interpreting what happened in Flint, but also because there have been 15 civil servants indicted so far in relation to how this was handled in terms of lead and Legionella. Some of the charges are very serious. There's felonies, there's manslaughter charges. And I think you're kind of familiar with the Flint story. Eventually it did become kind of an international, national sensation and written up in Time magazine. I testified at 3 congressional hearings on this issue. It was declared a federal emergency in early 2016, and of course FEMA resources were mobilized to try to bring in resources, bottled water, filters, lead testing the children. And it prompted a whole debate about not only government agencies, but also our declining state of our infrastructure, how you manage cities going into bankruptcy. And so a lot of, hopefully, some good will come of this in terms of not repeating these mistakes. And in terms of broader impacts, we did achieve the pinnacle of scientific success, which is to get on Comedy Central. And that happened to us 3 times, so I'll play one clip here.
The saddest thing about this leak is how little it would have cost to prevent it all.
The fix
was about $100 a day. All of this could have been avoided for just that small amount of money.
$100 a day. If I understand something, I want to pull out all my people in Africa right now watching today's show. Because my friends, for only $100 a day, we can save a village in America. The water that they so badly need. For just the price of 5 cups of coffee in New York.
Okay, so yeah, you want to laugh or else you cry, right, situation. But you know, the response to what happened in Flint has truly been amazing. It's kind of restored my faith in politicians, and both sides stood up. Everyone, there's something about Flint that makes everyone angry. To date, it's just incredible. There's been more than $500 million of relief that has flown into Flint in all its different forms. And so in early 2016, after the agencies involved who caused the problem tried to become part of the solution, and they switched to Detroit Water, implemented corrosion control, we went back to Flint, and we generally found things were much, much better, as you would expect. This is just one simple picture of that same tap in the hospital and how much better it is on the right after that switch and after the relief agencies were implementing enhanced corrosion control and enhanced disinfection. And at this point, you would probably think, okay, we can try to get things back to normal in Flint because the right people are doing all the right things. Money's flowing here. We're going to try to help get Flint fixed. But you would be wrong. And the reason you're wrong is because of the two alternative flight paths for microbiology of the built environment. I'm going to talk about two of these. It turned out that Flint attracted a lot of unscrupulous and unethical people who wanted to exploit it for their own benefits. And amongst those were some clueless microbiome researchers who came to Flint after the emergency was declared, and they're not in this room, and they were not part of Sloan. And I think this is very, very important for us to realize that, you know, we've been spoiled. We have had a chance to learn this from the bottom up. We've made mistakes together, and other folks out there with these tools haven't had those experiences. And so I think we have to take on a role, hopefully, of disseminating these results so that these mistakes are never repeated. And I'm going to show you an example of how that played out in Flint. One of the questions that was tackled by this group of academics who was given $4.5 million to go to Flint and do studies to help the population was whether the free lead filters provided by the relief agencies created a problem for bacteria. Now, I supported the funding of these groups to do this study because this is a very important question. But you have to realize, again, as it was stated here, you have to know the history of these areas. And this area has been studied for 40 plus years. And there's actually consensus statements that are out there from World Health Organization expert committees that acknowledge that these filters grow massive amounts of bacteria. We've known that for a very, very long time. 2-3 log increases in bacteria, but the studies that were done using the earlier tools did not show that there was any significant health harm to be expected from these higher levels of bacteria. So the general idea was to come in and restudy this problem using newer molecular tools, just as we've been doing in Sloan. But very, very quickly, in my opinion, this went wrong. And so here's sort of what happened. They used these molecular tools, and they discovered increased levels of Enterobacter raceae coming from these filters. And the oversimplified logic is because some of these bacteria are pathogens, we should alert the public that these filters are probably posing a health hazard. So here you are in the midst of all this lost trust. The government is providing these free lead filters to protect the public from a very serious hazard. And this one group starts announcing their results about their fears of these bacteria. And they did so at public meetings, and I'll just show you two of the press releases that came out of this. This is the headline: water filters could increase bacteria. And the researchers gave their opinion that after residents use these filters, that they should run them for at least 1 minute and possibly boil the water or UV treat it or disinfect it after it came out of the filters. And so when these researchers were asked, is that only for the water from the filters you're making that recommendation, or are you recommending it for all water from the plumbing, they wouldn't answer that question. So here's another headline during the same public presentation in December 2016, where they announced to the public there's issues with the use of point-of-use filters. They're good at reducing lead, but the bacteria increases. For bacteria, there is an issue. And the activists and the citizens who watched this, of course, this reinforced their worst fears, that this system was still not fixed. So on social media, you can kind of see how this rolled out. Oh, now we've got bacteria problems from the solution. Everyone should stop using the lead filters because of the bacteria problems. Why is the government using us as human guinea pigs? Because another thing this group didn't do is to acknowledge that these filters are being used all around the country in roughly 25% of the homes. And so you can see the chain reaction this set off in terms of just distrust. And so this is the kind of emails that I and the other relief agencies were getting at this time. People questioning us, and what about this Enterobacteriaceae? Why is no one talking about this? And so we were able to, again, tap into our Sloan experience and look back at a paper that we'd just written, which was to answer the question, are Enterobacteriaceae abnormal in drinking water? And so we had just published a paper on that, led by Pon G, and looked back at our data, and what we discovered is that over 62% of our water samples that we surveyed from normal water systems all across the United States had this Enterobacteriaceae in there, and no one was telling them to use UV treatment or boil their water or flush their system. And we also found that the normal levels of Enterobacteriaceae were between 0 and 10 to the 6 gene copies per liter. So there was nothing unusual about what was happening in the Flint water or in the Flint filters. But, this group has continued to allow their information to be published. This is from August of this year, where there was this news release, and again, announcing on TV that the water filters that everyone's trying to get the residents to use to protect their health are, the findings about these are alarming, because a shocking new study suggests they may be letting other toxins pass through the filters in dangerous amounts. So you can imagine, the impact that this kind of misinformation was having on the Flint public. And unfortunately, they didn't just limit their missteps to the use of the filters. So they went to other homes, and they found pathogens in some of the other homes. One of the pathogens they found was Stenotrophes multifila. And so there was a release because they told one of the residents that they had this bacteria, and they put it in the context that this was very, very rare and should not be in her water. And she asked what she could do, and one of the researchers told her, well, if you wanted to feel safer, go get a respirator and use that in her house. And so she abandoned her house because she was so afraid, and she will not go into her house without using that mask. And in terms of just how rare this bacteria is, Sarah Haig just yesterday had a poster presentation. She was talking about the fact that 90% of the homes that they test in Ann Arbor have this same strain of bacteria. So are we going to, issue masks to people in Ann Arbor and tell students there that they can't drink the water, And then on top of that, they did have a web presence, but it wasn't the type of web presence that I would recommend. The professors involved in this used this to spread misinformation and to attack the relief agencies and to attack us. Here's just one example of their unprofessional sort of posts where residents were kind of questioning them, like, what's the source of the disagreement here about the status of water in Flint? And one of the members of this team responded, well, one source of disagreement is whether or not to say that lead is the only pathogen of concern. And that certain groups say that lead is the only pathogen of concern, and the people on her team says it's not. So, well, first off, no one would be happier if lead was classified as a pathogen than me. Because I could then claim I was doing built environment pathogens 25 years before it was even cool. And secondly, after Jeff's talk about lead as a probiotic yesterday, this leads to all kinds of interesting lines of research. And I was even thinking last night, maybe lead caused the rise of the Roman Empire, not just its decline. So if so, you heard it here first. But, this was really not helpful. We repeatedly asked them to stop their unprofessional attacks. They kept going with it. And I think it's an example of just how bad this can go wrong. Now, you might think that's as bad as it can get, but you would be wrong. I'm going to lay out some actual events that I feel illustrate how science should never, ever be done in terms of microbiology of the built environment. So again, into this vacuum of distrust in Flint. Unethical, unscrupulous actors came to town. One of them was a Hollywood actor named Marc Ruffalo, and his nonprofit organization, Water Defense, came, and they seemed intent on the start to find non-existent dangers from bathing and showering. And if you don't believe me, this is their first YouTube posting that they put up 5 minutes after they came to town.
Where they told us not to drink the water, but it's okay to bathe in it. The question is, water is not safe to drink. Why is it safe to bathe and shower in?
Okay. So at this time, you got to realize EPA, CDC, the relief agencies, we were all saying that the water for non-immunocompromised people was safe for bathing and showering. And this group was intent on getting a contrary message out. Now, I think we all realize through the proud history of Jon Snow, public hygiene, that basic bathing and showering is very, very important. One of the reasons it's important is Shigella, because it's spread most commonly through hand-to-hand contact, and the way we prevent it in my child's school and your child's school is to make sure that children are washing their hands and taking breaks to wash their hands. And people were so afraid of the water at this time, I was getting calls from moms saying, is the water safe for hand washing? And they weren't. They were actually using those wipes because of the fear was already so high. So this is the situation with Shigella in Flint, and you can see the moment that Water Defense came to town and posted its first YouTube video. Now, their first approach was to claim that they discovered unprecedented levels of chloroform in the showers, that these showers were essentially gas chambers exposing you to these high levels of carcinogens. And the claim was that they'd been to 62 disasters, never saw any levels of chloroform like this. And just so you know, this person who's the chief scientist of Water Defense has no scientific credentials at all. And one of the first things we did is check out these claims with third and fourth party studies, and what we showed is for TTHMs and chloroform, the levels were completely normal. Now this took several months to prove, but by this point, people, again, fears about bathing and showering. So that didn't work out, and they continued to post things on YouTube claiming that showering and bathing in Flint is not safe. Eventually, the local media started to pick it up, and many, many news channels reported their opinion that they couldn't show that the water was safe to bathe or shower. And we tried very, very hard to reason with these individuals, but one of the things I've unfortunately learned is you can't reason with unreasonable people. And so we got in a confrontation with them, and it was very, very unpleasant. I don't like to go this path, but if the alternative is to stand by and let innocent people be harmed with scientific misinformation, I'm going to go there. So we published on our website, it was picked up in other media, talking about the bogus misinformation that Marc Ruffalo and his group was spreading in Flint. And it got quite a bit of traction, and eventually, I don't know, I can't prove that any of this is related. The Shigella outbreak is related to what happened, but it was one of the worst Shigella outbreaks in Flint history, and if ever you wanted to have the wrong message at the wrong place at the wrong time, this would be it. So eventually, by late 2016, this problem had gone back down to normal levels, reinforced by public messaging from the health department about the importance of bathing and showering. But at that point, you know, again, you think it can't get any worse, you would be wrong. So this group formed an alliance, it seems, with this TYT Politics Network. I don't know if you've ever heard of this, but this is apparently the biggest online news organization in the world. And I'm going to warn you, what you're about to see is really for mature audiences only. Some of you are going to think it's funny, some of you are going to think it's horrifying and tragic, so this is rated F for fear-mongering. But what I'm going to present to you is some of the snippets of the videos that show the methods of how these folks were collecting their data about bacteria and how it was presented to the public in the aftermath of Flint. Realize this is after they were called out in Flint. So we put it into a 12-step program on our blog to out them and out their methods. I don't have time to go through all of them here, but the first step is to go and get a kitchen knife that presumably has not been sterilized, I don't know, and an unsterile water bottle, and go and collect samples from the built environment.
Hey, Sloan, TYT, why do I have a knife and a water bottle? If the EPA is not going to do the testing, I will.
Okay. So step 2 is you want to find things that no one else can find, so you have to sample unconventionally.
Scott Smith with the Water Defense Council. He's done private testing in about 30 Flint homes. He has gone through very, very extensively and carefully to find bacteria that the state has not found in Flint. Bacterias in just about every home he's tested. I'm not going to pretend to know the names of the bacteria.
Okay. So next, establish your team's scientific credentials to do this work.
Scott Smith with the Water Defense Council. You know, you're more on the scientific end.
I said I don't know whether it's safe to shower and bathe, and I'm not a doctor, I'm not a toxicologist, and I'm no PhD in statistics because I'm not a trained plumber or pipe fitter.
I'm no scientist, I'm no environmental expert. Most of you don't know this, but I was in special ed from 1st to 3rd grade. I had a learning disability. It's a whole story. I don't think I needed to be in special ed. I'm no doctor either. But also, I'm not a medical expert, but I am an expert on what medical experts have told me. Does that sound about right?
Correct.
Yes.
Well said.
Yes.
Okay. So now you go and collect your built environment samples, and do so because you're trying to study the water. Let's sample the outside of a sewer pipe in the basement.
So we're going to be getting water and what looks like a bacterial fungi. We're going to be collecting them, and he's going to be testing them. And by the way, I could barely set up a TV, so this could be tricky.
Okay, and so now you've collected your sample. Now you got to prepare it for shipping, and if you drop the bottle cap on the floor, no worries, because the whole point is to find bacteria that the EPA and the state don't find.
Good. Let me just put this on here.
No, it really does look like it's hard to set up your VCR.
Yeah.
Okay.
Okay, now, after you've collected these samples, you send it to an independent lab who has no idea where these samples came from.
Right. Because the key thing is the independent lab that we go to.
Okay, and now you have primetime discussions about your results
On last Friday's Power Panel, we showed you video of TYT Politics' Jordan Sheraton drawing water from a water heater in East Chicago, Indiana, that looked like absolute sewage. Scott Smith of Water Defense was our liaison for that testing. Exactly.
We tested it, and boy, it did not come out good at all.
Exactly.
It came out terrible.
Hello.
Hey, Wanda.
Hi.
Good afternoon.
Good afternoon. Hello.
Hi, Maritza. It's Scott. Happy Friday once again.
Happy Friday, Scott.
Hi, Keisha.
Hi, how are
Scott
you?
Here. Good. How are you? How's your day? How's your Friday? I have your results, and there are some similarities to Flint. As far as your water goes, I know you've got a lot of challenges. This bacteria
probably shouldn't be in your water, that there are health-related issues.
Okay, so you can see how this rolls out. And then if that's not bad enough, have Mr. Ruffalo go prime time on national media to explain their group's methods.
Not whether or not my organization is scientists, because we're admitted, we're citizen scientists, you know? And so all we're doing is giving people information, and there's nothing wrong with that. And the more information people have, the better off they are.
Okay. And so, you know, one of the things I've learned from this is it's very, very difficult to police science. It's not easy to sit here and criticize other activists, and you hope that their intentions are good until they prove otherwise. One of the things I've learned is these internet news sources, they don't take kindly to being outed in terms of their methods. So soon after our blog aired on this, I got these emails demanding that we remove our blog post or face the consequences. Jordan said he's working on an additional piece which prove you are a hack. He then threatened an online dispute with the largest online news channel in the world unless the blog post is taken down and we issue a correction, and we have not done that yet. So I have, as you can imagine, suffered the wrath of this network and their legions of fans. And the other thing I've learned is that Hollywood actors don't really take kindly to being criticized either, and I've got a whole pile of cease and desist orders, and I'm probably going to get a few more after this here today, and I will not cease and desist. And but you can imagine how this is played out in Flint. I mean, these are folks who have already been betrayed once by the government, by the agencies paid to protect them, by scientists, by Hollywood. And, you know, this is just an example of what it's like for some Flint residents today, the fear that they actually legitimately experience, and with good reason. You can't blame them after what they've lived through.
I have stopped using the filters again, and I'm back to bottled water. My water is not corrected. You know, I want to just shower at home. I want to be able to use my water, and I want my kids to be healthy. My one daughter.
And so, you know, what's left in Flint, you know, now that the water is sort of getting back to normal, they've had 2 years of back on Detroit water, 2 years of relief funding, hundreds of millions invested in the infrastructure, but no one trusts anyone. And this is our failing as scientists. So again, as you consider our own future, as we venture out in the world here, you know, there's different paths that microbiology, the built environment, can go, and I hope that the folks in this room can help steer this in the right direction, because you've seen just how wrong things can go very, very quickly. So with that, I just wanted to quickly recommend a great paper that just came out last week that talked about some of these problems, and I don't know if they knew anything about what was happening in Flint, but just talking about the dangers of communicating these results to the public, how things can go wrong, how you can steer people away from mass transit, how you can scare people to the point that they literally wash their dishes and take showers in nothing but bottled water. That's a possible outcome here. And so I'd just like to acknowledge my amazing collaborator, Dr. Amy Prude, and the whole Flint Water Study team from Virginia Tech. And at this point, I'll open it up to any questions if you have them. So thank you very much.